So this video is about ethics and ethics in study group. What we want to talk about today is not so much ethics as a rule, as a set of rules, but ethics as an ethical way of thinking, as an internal attitude that is linked with the frame, with the internal attitude of the analyst, and the study group are the foundation of future psychoanalytic society, so it's essential really that the work on ethics start from the very beginning. And in this video, we will work with Gabriele Juncker, Gabor Zoni, and Lena Klockar. The three of them are both chair of study groups, and also they had a huge experience in working in ethics committee, ad hoc group on ethics, so they're very familiar with ethical issues. I would like to start with Lena. Lena, you raise an interesting point about the parallel between the early history of psychoanalysis and the beginning of study group, and I wonder if you would like to elaborate on that.
Yes. Well, as we all know, at the beginning of the psychoanalytic movement, with Freud, with those people that time, they were so interested in psychoanalysis, in methods, theory, practice. They had to be very flexible, they had to create new things, so they probably didn't have so much time to think about ethics or this kind of things. I mean, there were things which were much more important. So I think ethics came much later, and I have been thinking maybe it's the kind of same phenomenon seen in study groups. I mean, there are other things which are more in the focus at the beginning. Ethics probably, well, comes later.
Yes, another thing that links with this is the fact that in study group often the member of the study group come from traumatized background, and they had a not so stable setting in their history, in their family history, and as training, they didn't have a psychoanalytic institute, they trained through shuttle analysis, so there is a difficulty really in establish or internalize an analytic setting and an ethical attitude that goes with that. Would you like to comment on that?
Well, I would like to get connected a bit with what Lena told about the early history of, because they had their ethics taken from medical practice, what they had, and through the method there came in a very new level of ethical questions which comes from the technique itself. And I think that those who are studying, are becoming psychoanalysts in new groups or in old ones, have also to go through this process to get to a further level of ethical points connected with technique.
It's so important for them not to be drawn by passion for psychoanalysis, just to do psychoanalysis, to act as psychoanalyst, but the reflective position is so difficult to gain, and the direction on what to reflect, what is bringing the psychoanalytical dialogue forward and what is hindering us, is on one hand very much linked to the psychoanalytic technique, but on the other hand it requires a firm inner structure in what to act, and I think this is very difficult to transport.
Is it something what Maria Teresa just said, that it is difficult to make it internal kind of setting, and with training we maybe repeat it, I mean with shuttle and Skype and those things?
I think the point of the firm internalized structure, in my opinion, is a fundamental point, and that's why it takes so long, in a way, you know, for study group to actually internalize, you know, not only an ethical way of thinking, but a frame, a setting. And I wonder on this there is also another issue that plays a part, and is what I call familiarity, the fact that the relationship between the sponsoring committee and the member of the study group are such a special relationship, such a particular relationship, which is so emotionally charged. And in this emotionally charged, enthusiastic climate of the beginning, you know, sometimes it has got an effect on boundaries, on the frame. And I wonder what your experience is on this.
I think there are 2 points. One of them is the general problem of for the study groups, that this process you were speaking about goes parallel. So they're all individually and all together have to go through this internalization process of the analytic stance. While in other societies, there is already a group of people who already has internalized this stance. And then when the sponsoring committee comes, has to face also somehow and assess somehow on which level or where they are in that respect, also going through the internalization of ethical, technical or general ethical points, I mean.
I think that is such an important point because in a way we are talking about you know, developing psychoanalysis where a psychoanalytic culture is not developed yet. And so we are facing all sort of issue connected with that. And the ethical attitude is part of that scenario.
I would like to this discussion about in a ethical attitude, the structure, the awareness of structure. This is not only in the consulting room, but also towards the colleagues in the group. And I was especially struck by the fact that it is so difficult for some group members to be aware of the structure in their group they want to give themselves to function. Because in the new groups it's very important to set a structure of an organization to be able to train. And as you said, by the familiarity of bonds to each other, it's very difficult not only to communicate with each other on a friendly friendship way, but also to keep the structure, who is the chair and who has which post, and to regard the limits that are given by this.
Yes, and we all know how difficult it is. I mean, if you are a very intimate group of friends, and then you really should, well, get apart and find your own positions, it takes a long time.
Yes, this point in my mind links also to another point, the respect also towards the patient, which links to the issue of confidentiality, because very often we found that clinical material is just sent around in groups, not disguised, with all details, personal detail about the patient, or now with the internet email. So I think what you're saying is really also need to be applied also to the relationship between colleague and the relationship with the patient, taking into account confidentiality and privacy.
Well, the profession of an analyst is terribly lonely. And every one of us has a strong wish to communicate. which we see on congresses, how much we talk. And with the passion of doing analysis, and especially under the pressure of difficult patients, it's so easy to transgress the structure of confidentiality. And we are just drawn by our own passion and wish to communicate, to do something which we, from the ethical point of view, is not at all fostering but hindering the dialogue.
Yes, what you said about difficult patients, I think during this 100 years, the patients really, they have changed. They used to be more, let's say, easy or whatever you call neurotic, whatever you say. Nowadays we do have patients with whom the, let's say, the boundaries are more, let's say, difficult to keep. Also, our methods have changed a little bit, working more with transference. So I think ethical issues have become more complex nowadays also, probably.
When you say more difficult patients, I would even say many of these so-called difficult patients creep under your skin.
Yeah.
And you have to cope with a transference situation that is really nearly bodily.
Yeah.
And this makes it even more problematic or difficult to hold the boundaries in a firm way.
Yeah.
And there comes in, I think, the importance of the sponsoring committee as a model. How can the sponsoring committee show a model in acting within the group of the sponsoring committee, how they hold the boundaries while teaching and training the new groups. I think this is an important aspect we sometimes neglect.
Yeah. Yeah.
I would like to add to those what you are telling further difficulties. So one of them is what you are speaking about, that also being on the sponsoring committee, there is always the invitation to get into double roles, and it's very difficult to to have this type of boundary. The other one is that being on the sponsoring committee, I have also an internal conflict. I am filled with expectation that they should be already full armored ethically, and it's very difficult for me to have a look where they are and where they are in this part of development.
Yeah.
And there is a clash between my expectation and what I see there, or I can get into the other trouble that because I think that they have to develop, I cannot be active enough in handling such developing ethical problems and conflicts.
That is raise another important point, which is, the sponsoring committee thinking analytically, and so the analytic mind of the sponsoring committee in this containing and the way it behaves. The importance of the sponsoring committee to be there as an example in a way, as a with a containing function and with the analytic mind working, and also this brings to the issue of how to keep the analytic thinking alive in study group, through ethical seminars, through ethical discussion, but something that doesn't have to be once for all, but something that has been continuing present and developed.
Well, I would like to bring in the task of the sponsoring committee. One of these tasks is to develop an ethical code. And I think this task is a wonderful tool to work through with the group what is ethics, because this ethical code has, according to IPA rules, also to fit in the local law situation. So the first step could be by a group to ask a lawyer to draw up an ethical code. But this is exactly what we don't want, because we want to show to the group that ethics develops from the psychoanalytic idea, the psychoanalytic clinical work, and I think it's worthwhile to have quite a time to spend with them on these ideas, because it provides a wonderful setting to discuss ethical questions in depth and give examples.
And maybe also an example how, I mean, if we as a sponsoring group members, we are talking with the, let's say, board or the study group.
Yeah.
But it's something alike they should do with their candidates. I mean, this is also this kind of parallel processes that how we contain, so they contain and they can be able to contain with the candidates. So this is really a process.
Well, maybe thinking how to teach ethics, I would also propose some extension, but it's a very strong starting point to go through the ethical code and to work it out together, to give examples and work through the examples. I also propose to make a teaching type which goes through the whole procedure, because it starts on a level of the techniques, then there is the interrelationship, how there is some kind of ethical small breaches which then develop into gossips and other things inside the society. And there is the very critical point where, when it's the question whether a complaint will be submitted or not. And at that point it becomes a very strong part of the whole group's functioning, sometimes the whole group's life. And then my proposal is to make such examples in which you can go step by step through this development, the explosion of an ethical problem, just into ethical complaint and into the ethical procedure, because people do not have experience to work with ethical procedures up until to the end, how it can be solved or cannot be solved. And there also in this technique also to face people with at some points where they have to take on also yes-no decisions in ethical questions, which is the most painful and critical for the analytic thinking, where we make question marks.
And also, I think
decisions.
I think it's so important to know at which point the sponsoring committees actually have to call for IPA ethical committee, because
Can I clarify that? Because a study group, the study group worked through, as you said, writing down an ethical code, but each ethical complaint cannot be dealt by the study group and has to go to the IPA ethics committee.
Yeah.
But Gabor, what were you saying? So you're saying that really is important also to teach or to work through, so that it's very clear to the colleague of the study group this progression from a minor boundary violation, how this can escalate, what Gabor called the slippery slope, to a major thing. So they got a scenario really of what
Well, yes, but because at that point we are already in the organizational dynamics as well, and in the what you mentioned at the beginning, that there somehow a culture of the group, an analytic culture develops or not, and how really personal people, because in our heads we have a lot of so should be and how and has to and have to, but not as much what we really feel and really act when we get into such situations, and to model such situations in their shared learning process for the group could be important.
I would like to add that I meet again and again a big anxiety linked to ethics. Because mainly ethics are represented as, oh, you are not allowed to do that. And this we referred already to a non-internalized attitude, but an externalized setting of laws.
No, it's very important, because ethical committees often get in a society alienated and seen as the body of ethics, and we are the other understanding people.
What I experienced was that very quickly, if a disagreement turns up, people say, oh, this has to go to the ethics. And I find it so important to convey to the group that disagreement is not ethics, but disagreement is something that can be worked through and mediated between different parties. And up to the final step for exclusion of a member for ethical reasons of the group, this is a long way to go. So I think it's important to alert the group to a very minor problems that can be held and dealt in within the group and not even called ethical problems.
That brings to mind something else which I think is important, that sometimes an ethical issue is a symptom of a dysfunction in the group, and sometimes you find that the weak member of the group become the symptom of something that really didn't function, is not functioning in the organization and in the group. So I think it's very important to see the ethical, whatever ethical transgression is brought up in the context of how the group is working before, targeting. It is such a easy, way to target someone rather than looking at the group functioning.
Well, you are right, but there is also, of course, often the opposite development, that very destructively ethical problems are covered and covered and covered, and it's also very difficult. So if you raise the question that if your friend does this, what would you do? If your very close colleague, what would you do? And then it turns out how difficult it is to also to face each other with what we think problematic in our behavior.
Well, this raises another issue, which is how ethical issues are covered up. And we find this all the time. We get a wonderful report in which everything is fine, and then one discovers that there are ethical issues that goes back in the history of the group that have got huge repercussion really on the functioning of the group, but have been covered up.
Yeah, but I think this is also part of, let's say, history of the study group and history of the sponsoring committee. At the beginning, you have this kind of, let's say, honeymoon period. You are so enthusiastic to start all kind of things. You don't see certain things. Well, 2 years, 3 years, and then you start realizing that behind these things are some other things which you could call more, let's say, ethical, but you didn't realize that at the beginning.
Well, because we can know later on at least the history of the group, but we never know the prehistory of the group or the pre-relationships which are brought in as shadow relationships and are there present from the very beginning, and there could be also very difficult ethical questions already hidden there from the beginning, because it's the interest of people that there should be a group, and then they have no other solution than not to speak about them.
One very tiny aspect of the idea of history is, I think, and linked to the topic of confidentiality, is how to handle and to build up an archive. I think when the group is beginning, they don't think of anything like this. And where are the papers? Where are the confidential papers kept? And are they locked or are they not locked? So this is another necessary step of development of organizational thinking, which is directly linked to my understanding to ethical attitude of the analysts.
Yeah.
It's the memory of the institution, memory of the institution that get lost.
Yeah.
And so one start all over again.
Yeah.
And also this history, all of them are coming from different kind of other societies, psychotherapeutic societies, medical societies. They already have had some kind of, let's say, experience about ethical things. Those experiences can be totally different than what our own, let's say, psychoanalytical, ethical, history or what we would like it to be. So they have to learn maybe another kind of, attitude.
De-learn also.
Yes.
De-learn.
Relearn.
Exactly, yes.
And this touches, I think, what you mentioned as ethics among colleagues, especially in these groups coming from so different trainings and coming in unstable situations, as we agreed on. It's so important to encourage these groups to really listen to each other, to take in the diversity of the otherness of the other thinking, and then making a space for jointly thinking through what do we want as something really new. I mean, what is our ethical standpoint, and not what is the best of what the members bring in.
Yeah, this is really one of the crucial factor, in my view, of the development of a new group, is the encounter between the culture of the group and the IPA culture, and how these two then work together.
Is it also that sometimes it's quite difficult actually to talk about ethics in that core group? I remember when you came to my society to give a paper about ethics, it was much more easy to discuss ethics, discuss the problems, when it was someone outside who in a way could tell things which no one didn't need to think that, she's talking about me, or we are talking actually about him, but we don't tell. So it's important to have seminars with candidates, with the study group, but it might be also important to have IPA or EPF or someone coming outside, really to bring in the issue.
So thank you all for this very interesting conversation that we hope to continue in another conference at another time. Thank you, Gabriele. Thank you, Gabor. And thank you, Lena.